Well, good morning, everyone. And every day we rise is a great day to be alive. And welcome to Portsmouth Coffee Talks morning show. My name is Slim, and of course, we're here with host, the Colonel, and Leah should be joining us soon. And we have guest host, Mark, and special guest host, after sometimes she's had a busy semester this semester. But anyway, returning is Dr. Ernestine Duncan. And good morning, Doctor. How you doing?
Good morning. I'm doing just fine. Thank you again for the opportunity to talk about mental health.
Yes, and thanks for. Hope everything's going well as you go into the holiday season at Norfolk State University and sending some of those students home. And as we talk about this subject, some of that might come into play as far as students, on campus or that live far away from home. That might come into play with what we're talking about. But anyway, this is the season that many people are excited for, that wait all year for, and the time to get together with family and friends, and that's a good thing. But it's not always that way for many other people for various reasons. Some people, and just to come into play as part of the conversation as well, uh, don't particularly uh, follow the faith of Christianity or what's happening this part of the year. So how do they cope with it? And then we have people that things have happened during this time of the year, loss of family members or friends, that is not the greatest reminder for them to spread some of the joy and cheer. So, Dr. Duncan, lead us off in this discussion about the thing, what we should do, or what some people should do during this time of the year that might have some issues uh, that are different from some of the other people that might this might be a joyous time of the year.
One of the things that we're really concerned about as we go into the holiday season, and maybe this holiday season more specifically than other years, is that people are already at a heightened level of stress. The workloads that people have, the work life balance that people are attempting to accomplish, those things are already made it so that we have a heightened level of stress. Then, when you add the holiday season to that, sometimes that involves travel, sometimes that involves being with family members for extended period of time, and that may be stressful for us. There's always the stress of the financial obligation that people often feel as a result of the holidays. There's the stress of um, what we know about um, that there's more darkness during the holidays, this holiday season. And so we look at people who sometimes have something called seasonal affective disorder, which is impacted by less light in our daytime and the basis of our time schedule and the change that has happened. And so there are many things that we can tailor based on what is the primary cause of the stress or the factor that is impacting stress. Interestingly enough, the number one cause of stress for people, based on a survey that was taken, a national survey that was taken during the holidays, is family drama. And so each of us knows what the family dynamics are in our family. And we sometimes need to give ourselves the grace or the permission to either limit our family interactions or maybe to avoid them and possibly not go home this particular holiday season. It is important that we do basic self care routines, which often get thrown off because of the holidays. But it's important for us to get adequate sleep. It's important for us to manage our eating, which many times, because of the holidays, there are meals and there are particular foods. It may even include alcohol in a way that we don't typically do. And so we have to balance those things as well. So just maintaining, staying aware, and maintaining what is important for us to stay balanced. Set boundaries. Those are things that are very important for us during the holiday season.
Yeah, two things I want to mention to everybody. You see that little darkness on Dr. Duncan's page there. It's an IT problem she's having, but we're getting the best part of her. We're seeing her. So that's the important thing.
Thank
And as she mentioned something about darkness, so don't think that's a part of her her presentation,
I'm doing
visual
okay.
presentation. Yeah.
Yeah, I'm doing okay in spite of the darkness.
Yes, but anyway, since you mentioned that, another part that people have to deal with, that the daylight saving times, that the darkness comes early, and some people have issues with that. Darkness comes early, and darkness sometimes brings depression among some people, and with it coming early this time of the year, that could be a part of emotional stress for some people.
Exactly. It's actually diagnosable. And for people who live in time zones where the sunlight is not out as much, we see more incidents of this diagnosis called seasonal affective disorder, abbreviated SAD. And we all need a particular level of light to generally set our circadian rhythm, to help us know when to sleep, to know us when to be able to awake. But when that is thrown off, it often causes difficulty in terms of emotional regulation. And we generally see people who will report being more sad and depressed. It's interesting that light therapy is the most usual and effective intervention for that, where we have people sit with a light box for a certain period of time during each day.
And what about sometime often that we can play a role, that some of us that are participating as in the joyous occasion of it, or anticipating this time of the year as a fun time of the year. What can we do? Should we be aware of, conscious of family members or friends that are in a different state of mind? Sometimes we can't ignore that. Sometimes we have to take care of those people as well while we're enjoying the situation.
Exactly. I think one of the best things that we can do is to just be aware, to notice people and their typical ways of interacting. And if you see that there's some difference with that for someone in our family or among our friends, that we open up a conversation about that without pressure, but just, maybe I notice you're not as lively as you typically have been. Or maybe even I noticed that you might be drinking a little bit more heavily than you typically do. Is everything okay with you? But allowing people the space to say, I don't want to talk about it. Well, if you do, just know that I'm here.
Yeah, and well, we want to welcome Leah for coming on, and knew she would come on sooner or later, but welcome Leah. And at
Thank you
this
so
time,
very much.
at this
Have to leave.
time,
Have to leave out early this morning, so I'm
uh,
just so I'm ready for you though.
oh,
Okay.
come
Good
late,
morning,
come late
Dr.
and leave
Duncan.
early. What a great way to come to work. But this is not work. But anyway,
Yes,
uh,
exactly.
right. Anyway, any other hosts have any questions or comments they like to make at this time concerning the subject? Go ahead, Mark.
Thank you. So I could see myself as Dr. Duncan was talking about seasonal affective disorder. I first heard the term some years ago, listening to the news actually, and I have for quite a number of years felt more irritable during the shorter days and longer nights, and self-diagnosed as being one of these folks who's affected by that. My antidote the issue, is light therapy in a different form. I have some timers in my house, and my front porch lights, which have uh, multicolored capabilities, come on just as it gets dark. I have a string of LED lights on my sun porch that come on just after dusk and stay on until I've gone to bed. And for some reason, the color takes away the drabness
Mhm.
of the darkness better than white light, and it's a mood elevator for me.
It's good that you were able to determine what can impact you in a positive way. Many times people don't, they feel the sadness, they feel the symptoms, but they really don't know what to do. And so I'm glad that you were able to determine, because I don't want to say this carelessly, but effective treatment is very simple. As you said, you just now have more lights and you determine the type of light that you respond the best to. So it's not as though we have to do anything really extreme in order to impact how we feel as a result of mood, as a result of light. It's just simply exposing ourselves to more light. And we confirm that it's seasonal affective disorder when we see the symptoms that happen beginning in the fall, and then they tend to ease up over the spring. That's kind of a
Uh,
confirmation.
yeah. Colonel, before you go, Colonel, I forgot to mention that Dr. Duncan is a professor of psychology at Norfolk State University and a former clinician who used to see patients. So just wanted to get that in so you'll know that she's our resident expert in this particular field.
Thank you.
You know, speaking of clinician, when I first got on the show, I was looking at the picture with Ernestine. And I thought my glaucoma was catching up with me. I just had to put that up there. Now that you've explained that it's an IT problem. So
if that's the case, we all have it.
Exactly.
So now people out there in electron lands can understand what glaucoma is. That's an example of it. So the other piece that, since we're talking about Ernestine and students and seasonal stress, one of the things too is students are finishing up their final exams, which cause a lot of stress. They got to finish up those last projects, coupled on to the final exams. They have stress of going home, because now when I go home, I've got the drama that I've got to go there. But I also have a certain degree of loss of independence, because when I was away at school, I was completely free. Come and go as I want to go. When I go back home, mom and daddy or grandma is going to say, you got to be at home by the street lights come on. And so that loss of independence can be played in there. And there's also a feeling that there's a certain segment will have a loss of or feeling of failure because my grades are not up to par. Will the people at home discover that I'm not doing as well as I was a valedictorian in high school? Now that I've come out here in the big bright lights of academia, and now I'm barely got a D average. And so I'd like to put that in there too. And the last thing I'd like to put in and ask Ernestine is, are there racial differences on an adaptation of stress?
On the adaptation of stress?
Yes.
That's hard to say.
Mm-hmm.
Because we believe that stress and how we experience it is a biopsychosocial response.
Mm-hmm.
The difference is, so the experience of it is probably something that is more common amongst races, gender, all of the different domains that we could look at it. It's the expression of it that appears to be differential. Whether or not we express it, how we express it, that seems to be different. And what this research tells us is that for people of color, we tend to repress or sublimate our stress. And it's not necessarily in a way that's effective for us because ultimately it causes issues with us physiologically. So it can explain some of the health disparities that we see, such as increased rates of cardiovascular disease, increased rates of hypertension, even diabetes, even mood disorders. We believe that the level of stress that is experienced is either equal or it may be increased for communities, individuals of color. However, what is different is the way in which it is expressed and the way in which it is managed.
Yeah, I've always thought that, and then the other thing you always think about is the numbers of deaths during that time, and what we call natural deaths. A grandparent or either a parent or somebody passes away during, and it's just a coincidence. There are higher numbers during the holidays.
There are higher. I'm sorry.
Go ahead.
I was going to say there are higher numbers during the holidays. In addition to grief is one of the factors that contributes to holiday blues as well, because not only do we lose people at an increased rate during the holidays often, but sometimes this is the first Christmas without grandma. Or we remember the holidays where our families were comprised of people who are no longer with us.
Mm-hmm.
And so these, again, are some of the things that pull on the emotions and lead to people having difficulty during the holidays.
Yes. Very interesting. Very interesting. And then what's the degree of financial stress? Because I always see that, when I was working, and I had always had to tell my people to work and you have to adjust during the holidays and not to go out there and spend enormous amount of money for a toddler to buy hundreds of dollars of toys that they're only going to play with one of them, and they don't know what's going on. Better way to do that. And then as the young people grow up, they wish they would have not. They get wiser and say, "I wish I would have not spent all that money when the kid didn't know it. I could have done that later on."
So if family drama is the number one factor that influences holiday stress, finances is number two.
Mm-hmm.
Often because if we don't spend the money that we would like to spend, we don't have it, or we're trying to balance and be more efficient, people sometimes feel guilt that they're not able to do financially for their loved ones as much as they would like to. So it's just the perfect storm when you think about the holidays of all things that increase the pressure on an individual. I really appreciate your discussion of the students because they are under an extreme degree of stress and they come home and that often is not abated.
Mm-hmm. Yes.
Dr. Duncan, let me, I want to say this, since you're talking about the children as far as the Christmas. I can remember being as a young child, I had brothers, but I was pretty much majority of my life raised as the only child. And when Christmas came, I was kind of loaded, and Colonel mentioned this, how many toys we need, but I was kind of loaded with gifts, even from other family, friends, and everything. And in my mind, I'm thinking that that was everybody's household. Everybody got the same amount. So when I went outside, I sort of showed off, everything I got, and not realizing that there was some of the people on my street or in my circle that might not have gotten anything. But so you think it might be important for as parents to make sure that their children know that everybody is not is not as fortunate to have as much So you have to kind of be careful as a child. I know it's a something heavy for a child, but you have to be aware as a child when you go out there that everybody might not be have the same as you have, because you could really do harm to your best friend by going out there showing off what you got, because you got so much and they might not have gotten anything or just one gift.
That brings to mind a couple of things. And in the introduction, I remember that you said that not all people practice Christianity. And so it is not really for them about what we call the reason for the season. And so I think often we have a distorted notion about what the holidays really mean. And if we could kind of come back to the center, it's not about the gifts, it's not about all of the things that you can amass during the holiday season, really. Even if you don't practice Christianity, there's a time in which we can do exactly what you're referring to. And that is, we could talk about giving to those who may be less fortunate than we are. And so I do notice that there are some families who may go and feed the homeless during the holidays. They are teaching the children in that family about how, one, not everyone is as fortunate as others, but also it begins to give those of us who have to give the idea that it is our responsibility to give. And so if we could take the focus off of all of the things, all of the gifts that we get, not just with children, but with adults as well. And what are we doing to serve our fellow man during the holidays? It would take a lot of the pressure off of the things that we see as it relates to gifts, gift giving, and money.
Yes.
You know what? Yeah.
Leah, I think you better get in there because before you
Yeah,
go out.
I'm gonna have to run out soon. But anyway, my focus is on a different place, Dr. Duncan. I'm thinking about those individuals who are in law enforcement and those individuals who are already under a high level of stress. What are some things that we can do in order to identify when they're having situations taking place, and what can we do to assist them? Is there anything that we can do to help them to lower some of the levels of stress that they're feeling, especially during the holiday season?
That's an excellent question. And I think that it really does apply across um, professions, but we really don't take the time with each other to talk with each other and to just get a pulse check of what's going on with you. I often ask people, when is the last time you asked someone, how are you doing? And I mean, really, because we look for that customary, I'm good, I'm fine. But that really is just a pat response. And often at the layer right beneath that, people can tell you very accurately about what's going on with them emotionally. And it's just knowing that someone cares to listen. We often might be afraid to broach that subject with people because we feel like we have to fix it. But you'd be surprised to know that just acknowledging it for someone, and you may not want to talk now, but if you ever want to talk, just know that I'm available, and then be available when they reach out.
You're
Thank
exactly
you.
right, Doctor. You have to be, if you ask that question, you have to be willing to listen. So often some people ask that question and they're not really sincere in hearing, 'cause especially if someone asks that question and you start saying, well, let me tell you a little something, they walk away.
Mhm.
So,
Or
when you ask that question, make sure you're sincere, and that you're prepared for an answer that's
yes,
longer, possibly longer than I'm okay.
and also I would want to stress, and also be willing to listen.
Hmm.
Hmm.
At that point, it's really not a conversation, because sometimes there are those of us, because of our own level of stress or trauma, when someone tells you, they begin to tell you what's really going on, the response is, well, honey, that's nothing. Let me tell you what's going on in my life. And,
Mhm.
and that minimizes, first of all, it minimizes what the person is confiding in you, but it's also probably making it difficult for them the next time there's an opportunity to be open and to be honest about what's going on with them. They're going to be less likely to do that because they don't feel heard.
And Doctor, Mark might come in on this too. We all know
Yeah.
people that probably might be spiritual and not necessarily religious. And the birth of Christ is based on, and Christmas is based on the religious beliefs. And spirituality might be a little different, or that person. And we know people like that. Should we tiptoe around those people because sometimes those people might feel uncomfortable, or they might not share. And you kind of touched on it, about some people that don't believe, but they might not share that belief. But should we tiptoe around it, or should we? How should we handle that, or how should those people that don't believe handle that? Should they back away or shy away from their friends because Christmas is not something that they are really into?
My suggestion for that is that honest, open communication involves equal partners in the conversation. And so sometimes when we take the position, well, I'm going to tiptoe around that, I'm not going to bring this up, it assumes a hierarchical position that I'm the one that has to moderate how this communication goes. A very simple question is, I know that we have differences here, and I'm wondering what would be comfortable for us to talk about, how you would prefer to have this conversation, and allow people to tell us, as opposed to us believing that, well, I'm going to hurt their feelings if I say this, or I'm going to negate their feelings if I say this. Just let's ask and have an honest conversation. I hope I don't offend you, but I don't really know how to have this conversation with you because of the differences in the way that we believe. So, can you let me know what's comfortable for you? And I will let you know what's comfortable for me. Those are not ways that we typically talk to each other, but those are strategies for open and honest communication, which gives a level playing field for everyone in the conversation.
Mark, you wanted to get in?
Yes,
Well,
yes. So what Dr. Duncan just said resonates with me. I come from a different religious and cultural background, uh, as opposed to the majority of people, especially in my community in Portsmouth. And the main thing is the honoring of other people's traditions has been uh, deficient in the majority culture. Um, so I think it's important that we learn about other people's traditions. As as I went back to the university in back in the 2000s, I took a course in world religions, which gave me some insight I hadn't had before about what Muslims do, what Hindus do, what people of different faith traditions do in their religious practices. And it has helped me to understand more of the world around me and the people in it. Um, and one thing that I find about Americans that uh, comes out of a multicultural approach is there seems to be a widespread appreciation of other cultures' food.
Yes.
If there's anything in America that brings us together, it's good food. So, so we should celebrate that as well and recognize that it comes out of um, our differences.
I could
And
not agree more. And I really appreciate honoring, learning and honoring the differences among us.
Since we're talking about honoring, I think Ernestine, you mentioned about giving away turkeys, and sometimes they, backpacks or whatever during the holidays. But I just wanted to offer a counter view or a counterpoint to these two holidays when we talk about Christmas and Thanksgiving, when we're giving out all these turkeys and backpacks or whatever. And then to make a statement on how you'll see in these two holidays, the athletes, A-list stars from Hollywood, organizations, you see politicians show up all of a sudden, and through their 501c or foundations that they've created, where they've collected a lot of money, and then they use that sometimes, well, most of the time, they're using that for travel and whatever, for their own benefits. They sort of look at just those 2 days when the needs to feed the hungry, and just not the homeless, but the hungry, is centered on 2 days a year, when that need is 365 days a year. And then so I just want to make that point, get that point across, because a lot of times, these organizations, athletes, A-listers in these organizations who collect billions and tens of $1 billions a year to do it twice a year, don't create not one job, most of them, to get that homeless person or somebody off the streets with a job, to a house, to move on. And so I just want to make that point clear. Counter programming.
Mm-hmm.
Yes, I just want to make that point.
let me bring this up, though, since the Colonel just finished speaking. I think we have an issue too as far as the military. With so many people during this time of the year deployed or away from their families, and even if the family is together, they might be in Germany. They might be away from what they traditionally know as Christmas time. So, and how does that play? Because we've even had issues where soldiers. I don't know if this has anything to do with the suicide rate in the military, which is something that's of concern. But what about the well-being and maybe Colonel, what's being done in the military to help those military members who might be deployed during this time of the year, uh, away from families, maybe for the first time. And it doesn't have to be the first time. It might just be, the idea of being away from family and something that you normally are part of.
Well, you know what? And having been deployed during Christmas time, Thanksgiving, and missing those holidays away and being away from my family, for one, just not family back here, but being my family where I've been stationed. I've been, out in the desert or somewhere. There's whole organization. You have the chaplain corps. They're giving all these, services to all the religions and seeing all. And then you'll always have the big meal that the contractors and the chefs and everything. You'll have this one grand meal, and you do eat good. And then your command also jumps out there, and they may be out there for the one time serving meals. Sometimes we see through it that even though they may, I say they see through it that they're helping their troops by serving that one meal. But I came as I got older, and I saw through that. I always saw that was forced labor for them, because I was forced to do that, to stand in there when I tried to tell the commanders, you need to do this year round, because there's a difference in leadership when you only come out twice a year versus I'm doing this every day. And then so I try to educate them. So there's a whole things that a whole host of things that the military tries to do to take that edge off of you being away. And they open up the phone lines, and you can get to the phones. You can do the internet to buy those Christmas presents when you're away. I remember, being in Iraq and just going on Walmart and all the stores and ordering getting my kids Christmas presents and doing one at a time, because I know the kids were looking at having stuff under the tree, and they were young enough to do the numbers count thing. And so you order one time, so they would have it come to the house boxed up in one, rather than me doing one big order, a whole lot of orders, and the tree would be filled up rather than one big box with everything in it. So and now I digress. But yes, the military tries to take that over, and actually, if you're deployed, your family, extended family, is deployed with you, because the friendships and things that you got that you would have had back here, you with the comrades, and you get that by strength, because it's that locked up in chain per se.
Okay, we're getting some distortion from somebody's mic, and that's sort of prevalent throughout our conversation. So I guess we don't know where it's coming from, but if you can mute your mic until you get ready to speak, that might help. And because I don't know where it's coming from, but I don't know if you all hear it, but I can hear it throughout the conversation. Do you all hear the extra noise? Okay. So it's coming, okay, go ahead. Doctor, I didn't know if you wanted to respond to that.
Okay, I think in terms of the military, in terms of those who are less fortunate, I think the colonel's points are very well taken. And in terms of improving our processes and improving what we can do for people, there is always room for improvement. There is always room for improvement. I do think, however, that is important to acknowledge whatever good is coming out of the situation, as opposed to perceiving it glass half empty, glass half full. Because our interpretation of stress is really based on the way that we perceive what is happening around us. And so if we tend to come with it can always be better, or this is not enough, it contributes to increased stress. So while I don't want to negate that, yes, athletes, the military command, they should really be more present. And these are not things that we should just address during particular days of the year. But to be able to enjoy what is being done during these particular days of the year, so that we can get some benefit from it. The physical benefit of being able to enjoy the food, the physical benefit of being able to enjoy the camaraderie, because sometimes it is not you'd be surprised to find out, I've been surprised to find out, that often it's not about the food when you bring people together and serve a meal during the holidays. It is the camaraderie, because we live in such isolated ways. And there are those who are disenfranchised, and they don't have it, they have very little human contact. And so to be around other people, whether we're eating or not, well, I do agree, food is the common denominator, and it often brings us together. But sometimes it's that other thing, and that other thing is to be around people who we can engage with. And we take that away sometimes more significantly than we do the food or the backpack or the gifts.
I know one thing, the food, after the food is one of those opportunities where we can get a good sleep. Right, Colonel?
Yes, yes, yes. But
I'm talking
Ernestine,
from experience there.
but you mentioned the camaraderie, and that's what the military feeds on. If you saw the Army Navy game this weekend, you talk about camaraderie. And I always thought the better leaders, though, practice that same camaraderie year round versus these one event
I
kind of thing.
agree.
And the other thing is, I used to go out and lecture and go to the advanced course and talk to, every time I gave a speech on leadership, I always told these young folks, I care about you more as a person, you and your family as a collective unit, more than I care for you in this military thing. Because I, having reached a senior rank at that time, I saying, I could care less about the rank in the ranks between you and I, but I care about you and your family, because if you and your family are one a whole, then you'll take care of the organization, and the organization will thrive. And that's why you saw me say is that when I was a chief nurse executive at a hospital, you could see me. I'd be at the hospital at 1 o'clock or 3 o'clock in the morning, just sitting down with the staff. And when I took over, I said, I want to have appointments, at least 20-minute appointments or 15, 20 minutes with everyone from the sergeants to the privates. And then I'll get up to my staff and the lieutenant colonels, whatever. I'll talk to them later. But I want to see the people that actually make this ship roll, as they say, as a analogy, because I need to know how they click and how they are doing. And as you say, the least among us.
Yeah. There is no doubt that there are various leadership styles and effective leadership. And it sounds like that is definitely effective leadership. My concern is just for the individual who sees the command out on Thanksgiving, serving the food, not being able to enjoy it because their mentality is, well, he's only out here for Thanksgiving, or not be able to take the benefit of an athlete doing a toy drive because they feel like they need to do that every day. I don't disagree with you. I just am suggesting that in terms of how an individual perceives it, there are ways that allow us to be more positive in the way that we receive it versus what's not being done. And that's simply my point.
Yes. Part of my
Jim,
kind of program.
can I jump in for 1 minute?
Yeah.
Dr. Duncan, and I don't know, you may have discussed it earlier with my being late getting onto the show, but what are some techniques that we can use if we find ourselves going through these stressful moments? I know Mark mentioned how the lights help him, but what are some techniques that we can use if we find ourselves going through some stressful moments, and if we see others that we know are going through some stressful moments? What can we share with them to help them to reduce their level of stress?
So I love that question because it always allows me to focus or to reiterate that there's nothing magic here. It's just basic self care. The holidays are times in which we often burn the candle on both ends. We're up early because we're cooking, or we're up early because we're putting the gifts together. Or we're up early because we got to pick somebody up from the airport. We're up late because we got to pick somebody up from the train station. But making sure, first and foremost, that we get adequate rest. Secondly, to make sure that we eat balanced. This is a time when food and meals are very important to us. But how many of us honestly can say that it's generally the number one time that we overeat? And so, what does that do for us physically? Thirdly, pay attention to alcohol and substance consumption, because these are times in which we're celebrating and we often forget the basic things that we need. In terms of connectivity, again, open, honest communication with people. I'm feeling kind of stressed, so I don't think that I'm going to come to dinner until right before the time that it's going to be served. I will come another time, but right now I don't feel that I am able to. And on the other end, giving people the space to be honest in their communication, to not guilt people because they don't feel that they can come and stay all day at someone's house. So just paying attention to the basics and ensuring that we do that and we allow that same space for other people as well. It's often the expectations that we place on ourselves and other people at a time like this that causes a lot of the stress that we see.
Dr. Duncan, we often, and of course, you come on and talk about mental health, been on here a lot and talking about different stages of mental health, but we also talked about the importance of seeking help or getting regular, uh, having regular visits to a clinician, to talk over your things. And even if you are in good shape year round, and this time of the year has been a problem for you, this is the time you should really start talking to someone to make sure that you're good, even though you might not need it all year round. But sometimes we know when a depressed time is approaching for us because of for many reasons. So it's how important. Well, we know it's important, but what would you say, or what would you tell the people to do if they don't see someone on a regular basis? How would they approach getting help? During this time that might be a little dark for them.
There are many, many options. And since the pandemic, this has become a lot easier. There are many organizations that will direct you to finding mental health support in your local area. BetterHelp is one of them. Psychology Today is a resource that you can put in your zip code. You can put in demographics of whomever it is that you would prefer to see. If you'd rather see a male clinician, if you'd rather see an older clinician, a younger clinician, you can put in those demographics and they will attempt to match you with someone. But again, it starts with our honest appraisal of whether or not we need help. For many of us, it's sufficient to talk to a friend, to talk to a family member with that honest and open communication. But for some of us, and when we look at the fact that it begins to interfere with our daily functioning, so we're not sleeping well or we're not eating, when our emotional state begins to interfere with, and I've spent a lot of time talking about depression, but anxiety is another
Mhm.
psychological effect that we see during the holidays where people are increasingly anxious. If those things begin to interfere with our ability to function on an everyday basis, then we may want to seek some help. There are hotlines and there are many, many organizations. I also am a very big proponent of mindfulness and meditation. And there are many apps that you can use that will give you meditation videos that will allow you to just kind of calm and take ourselves away from the hustle and the bustle. And so those are the things that I would recommend. I know that I've seen Mark's hand up a couple of times, so I wanted to just check to see if there were a question or a comment that he has.
Yeah, I apologize. I didn't see it, Mark. Go ahead.
Thank you. Thank you, Dr. Duncan. Yes. So I'm a person who works very much in the political realm, and I was a little surprised when I got an invitation to this particular program. But my friend James really knows a lot about me on a personal level. Um, and so, having said that about the political, this also enters into the holiday equation. In my immediate family, with my siblings, we are pretty much on the same end of the political spectrum. But when we start interacting with other branches of the family, it's not the case. Like other things in life, the more diverse the group is, the wider the variety of opinions. So I've found that I need to tread carefully when discussing current events and national affairs in a family setting. And when I know that there are flashpoints among family members, those are topics, open and honest communication notwithstanding. I tend to steer away from them so that we don't get on each other's nerves because family really, there are many things to talk about that don't involve the outside world as much. And when we need to be able to enjoy the shared memories from our youth, particularly from earlier times, and remembering the members of our family who aren't with us during the holidays.
Mm-hmm.
There have been family fights during Christmas.
Yeah. Yeah. But I think honest and open communication is just that. There are other things that we can talk about other than what's happening in the world, other than our political viewpoints, so that we can make memories and that we can focus on our youth and our memories past. That is an honest communication. Honest communication doesn't mean you have to talk about everything. Again, we talk about setting boundaries, but being honest about why those boundaries are being set.
As we're winding down, I like to say that because it's a lot of people that have jobs that this time of the year, where most people might be off, say like the shipyard, they're off for two weeks or maybe more. School is out, and so teachers that are in the school system, they are off. But there's certain jobs, and I worked in retail for a number of years, and Christmas time wasn't always the best time approaching. It was the best time for us, the mission uh, retail workers, because we made a lot of money during that time. But you had like one day off,
Hmm.
which Christmas Day, and you're right back the next day after, and you're dealing with huge crowds and people that were stressed out. And so it's a certain amount of things for people that those kind of jobs around Christmas time have to be aware also, take care of themselves. It take some me time whenever you can, because it can be a stressful time of the year for people in retail and those other jobs that are not off for extended amount of time during the holidays.
I would imagine the colonel could tell us a lot about that as it relates to nursing and
Mm-hmm.
medicine.
Yes, yes, especially nursing. Yeah.
Yes. So, yeah, again, just engaging in setting boundaries. You have to work. You know that there are going to be increased numbers of people wherever it is that you are going to be pulled on in different ways. Then you have to set boundaries for yourself when you are home. And that may mean you need to have the first hour at home alone. But being able to set those boundaries and to state what your needs are, and family members being able to respect that, very necessary.
Yeah.
So
So okay, well, go ahead, Colonel.
go ahead. Because I've been sitting here out and you're talking about boundaries, and then and I had something on my mind, but I'm trying to keep to that boundaries because I want to tell everybody that and I got to step over this boundary for those of people that are asleep in the world, that are living in these Southern Confederate states, that has listened to the rhetoric of we can have abortion care with exceptions. You are getting a prime example to that rhetoric in the state of Texas when they talk about exceptions, where they are willing to let women die before they get those exceptions. And if she goes out of state to get this abortion, that if she doesn't get it, she's going to either die or never have another child. Places she'll probably die. And if she goes out of state to get an abortion, they're going to allow any public citizen to sue you, her, or her family that assisted her to do that. And if a doctor does the abortion, or anybody that, like a nurse, helps them, you're going to lose your license, and you're going to go to prison for 10 years. So those people that listen to the rhetoric, yes, we can have exceptions. I got a bridge to sell you in Alaska somewhere, and you got to get out of here. I mean, you have to listen and educate yourself. There are no exceptions. The Republicans want a total abortion ban across this nation, and women will die.
Yeah, and I think that's appropriate, Colonel, to bring up the political part of this as far as how it correlates with mental health, because a lot of people that are, and Mark, you talked about family, talking about and how it can get, but a lot of people that are really aware and into politics, it can really blow your mind to watch what's going on now. So you have to make sure that you take care of yourself as far as that's concerned, because some days I watch the news and see some of the things that's said or that's trying to be done that really blows my mind, and sometimes almost take me to the brink of just wanting to run out the house and run around the block a couple of times. But it's important too for people that follow politics and are really into it to make sure they maintain a healthy mental stability, as they deal with the way the world is today.
The one thing I didn't ask was, is there any correlation from the stress from the holidays and these mass shootings across the country?
Not that I'm aware of. The mass shootings are happening pretty much across the calendar year. And it doesn't appear that there's anything in particular about holidays that triggers them. It seems to be more related to the individual, the perpetrator, and whatever incidents are happening in their life. For example, just recently in Nevada, the faculty member, it appeared to be more personal, individual. That was the trigger for him.
Okay, well, we've come to the end of the show, and Dr. Duncan, I'd like to thank you again, and we will continue to talk about mental health and the effects on society, and how important mental health is to your physical health as well.
Yes.
You can think you're in shape, but you start having issues, mentally, it can affect your physical health. So you have to be conscious of that as well. Excuse me.
Yes.
So, Dr. Duncan, I know you do a lot of things in the church, making people aware of mental health. So, what would you say in a nutshell to people that have issues, this time of the year, as we approach the Christmas and the New Year, for them to make it through this? I know we talked about different things, but if you had one statement or paragraph to say to a group of people, what would it be?
And again, I'm saying the same thing over and over again, because I believe this is the thing. And
Repetition is good.
Repetition is good. Self-care, being one, mindful of what we're experiencing. If we're tired, if we're irritable, if we are anxious, if we are sad, being aware of that, not detaching from what we're experiencing emotionally, not assessing and judging whether or not the emotion or the feeling is valid, just acknowledging that it's present, and then allowing ourselves some grace for whatever that is. I know the Colonel mentioned political position. Sometimes your politics are the issue, or the issues that are at hand are so significant and important to you that you cannot deny it if you feel strongly about that. So acknowledge that that is your feeling about that, that is your belief about that, and that you may not need to have certain conversations because all they're going to do is heighten your level of stress. It doesn't mean that you don't believe whatever it is as much as you feel that you believe. It just means that you're protecting your peace. And I know we've seen that motto, protect your peace.
Mm-hmm.
Engage in those things that will bring you peace. Don't forget the basics during the holidays, and that is getting adequate rest, eating balanced meals, paying attention to substance use, whether it be alcohol or other substances, utilizing your faith. James mentioned I do a lot of things with my church, but there are services that you can attend. There are events that churches and other organizations are offering through the holidays. Try your best not to isolate. And finally, if you feel that none of these things are sufficient, there are many opportunities to reach out to professional help and to get us through the holiday season.
Well said. Well said.
Okay, thanks again, Dr. Duncan. We appreciate you again. And any last comments from the host before we continue on? Okay, go ahead, Mark.
Yeah, go, Mark.
In light of our earlier conversation, happy holidays, everybody.
And I'll echo what Ernestine said. She said it so well that I can't have a follow on with that. But happy holidays, everybody.
Happy holidays.
Yeah, happy holidays, and be safe and take care of yourself, and watch out for your friends and family members. You know, we can all help each other in this during these holidays. You know, just be aware that some people are hurting out there. Some people are dealing with some things. So just be aware and help out as much as you can. And even if you're hurting, recognize it and get help. And during the whole show, you saw the number that scrolling across the bottom, the 988 suicide and crisis lifeline. And Dr. Duncan, that crisis lifeline, that's not just for people that contemplating suicide. It's for someone just needs somebody to talk to, right? And don't have anybody else.
Yes.
Okay.
And two resources that I mentioned, I would like to just reiterate, and that is BetterHelp, as well as Psychology Today provides resources for people to identify mental health support in their local area.
Okay, thanks again, and thanks everyone for watching. We appreciate you, and we'll see you this Thursday at 7 p.m. with another intriguing panel conversation. Take care, everybody.
Thank you for the opportunity. Bye-bye.
Bye-bye.